Pregnant women need to be aware of the foods they are putting in their bodies as it affects them and their developing baby. It is said that women should increase their caloric intake by about 350 to 500 calories per day after the first trimester. During pregnancy, women should consume more calcium than they needed before. Calcium helps the fetus grow and develop properly. Dairy is a great source of calcium. It also contains phosphorus, some B vitamins, zinc, and magnesium. Greek yogurt contains a large amount of calcium. Some yogurts are probiotics which improve gut flora. Consuming probiotics can limit chances of complications like preeclampsia, gestational diabetes, vaginal infections, and allergies. Preeclampsia is a disorder found in pregnant women that can cause kidney and liver dysfunction. Folate is a key necessity during the first trimester of pregnancy. Folate is one of the 8 B vitamins. It can be found in legumes such as beans, lentils, peanuts, and a few others. Besides folate, legumes also contain other crucial nutrients like fiber and protein. Folate deficiencies can cause neural tube defects, low weights at birth, and immune deficiencies and diseases when they are older. According to the article by Healthline, most women fail to meet the folate intake requirements. Beta-carotene, which is converted to vitamin A, contributes to cell and tissue formation for the fetus. Vitamin A is an imperative part of development. Sweet potatoes are a fantastic source of vitamin A. They also offer other nutritious benefits, such as being rich in fiber, which helps with the feeling of satiety and is of low glycemic index value. Omega-3 fatty acids are lacking in most pregnant women's diets. In fact, the average person is not getting enough either. Omega-3s, such as DHA and EPA, are important for the baby's development. DHA and EPA participate in the formation of the cerebral cortex, skin, and retina of the eye. Incorporating DHA and EPA in the diet helps develop the brain of the fetus. In the elderly, it helps prevent dementia and Alzheimer's disease. After pregnancy, mothers may continue to incorporate omega-3s in their diet to help in creating breast milk. Seafood is rich in omega-3s, however, pregnant women need to restrict their intake because of the high levels of mercury. Being exposed to mercury can destroy the baby's brain and may cause vision and hearing complications. The mother can also be at risk for severe issues. Foods low in mercury include salmon, shrimp, and catfish. Besides being rich in omega-3s, salmon is also rich in vitamin D. Vitamin D is used for creating strong bones and a healthy immune system for the developing fetus. Vitamin D deficiency has been linked to cancers and other diseases developing later in the child's life. Preeclampsia is also a risk from failure of not getting enough vitamin D through the diet or supplements. High amounts of vitamin D, A, and omega-3s can be found in fish liver oils such as cod and wild salmon. However, women need to be cautious not to consume over the recommended dietary intake of vitamin A and omega-3s because it could negatively affect the baby. Choline is another essential nutrient for the baby's health. Like folate, lack of choline can lead to neural tube defects. Folate and choline work in tandem to promote a healthy fetus. It contributes to brain formation and advancement. Most people do not consume enough choline in their diets. It is a critical part of pregnancy to avoid brain dysfunction. Cruciferous vegetables such as cabbage, broccoli, kale, and cauliflower, and eggs are an excellent source of choline. Eggs are also a great food that is high in healthy fats and protein. Fiber helps in preventing constipation, which many pregnant women suffer from during the 9 months, benefiting the digestive system. Good natural sources of fiber include broccoli, kale, and spinach. These particular vegetables also contain vitamin C, K, and A, and other nutrients. These vegetables help the baby to gain a healthy amount of weight at birth. Iron can be found in lean meats, such as chicken, beef, and pork. Pregnancy creates a need for women to consume extra protein because their blood volume is increasing. This is especially important in the final trimester. Iron is needed for transporting oxygen throughout the body by red blood cells. Iron deficiency anemia is caused from lack of production of healthy red blood cells. It can cause babies to be born prematurely and at an unhealthy weight. Many women become disgusted by meat, making it difficult to obtain the proper amount of iron. To improve absorption of iron, women can consume foods with high amounts of vitamin C, like oranges and berries. Vitamin C helps support the immune system. Berries are filled with antioxidants that help with supporting the baby's brain. Additional foods that are beneficial in pregnancy include whole grains, avocados, and dried fruit. Whole grains help women achieve all the extra calories they need. As stated earlier, women should increase their caloric intake by about 350 to 500 calories. Avocados contain healthy fats, which support the production of the fetus. They are also high in potassium, even more than bananas. This can help in relieving cramps due to pregnancy. Dried fruits such as dates and prunes have other health benefits. Dates help in dilating the cervix and reduce the risk of induced labor. Prunes help in alleviating constipation. The key to dried fruit is avoiding the ones that are covered in sugar. Because blood volume increases, it is crucial that women stay hydrated, as it is easy to become dehydrated. Our bodies need close to 2 liters of water each day. Water helps decrease the possibility of urinary tract infections, UTIs, and alleviates constipation. For the best and most healthy pregnancy, women should avoid certain drinks and foods. Expecting mothers should refrain from alcohol. Most people are familiar with fetal alcohol syndrome, which is what occurs after severe alcohol abuse while pregnant. However, any amount of alcohol can be detrimental to the child's brain development and can affect it years later. Issues range from learning problems to lacking basic social skills. They should also avoid excessive caffeine. Most studies say that 1 cup of coffee a day is safe. There is a possibility that excessive caffeine could be related to miscarriages. Pregnant women should also avoid seafood, fish containing high amounts of mercury, raw and uncooked meats, and unpasteurized dairy products. As stated earlier, pregnant women should restrict their seafood intake due to high mercury levels. According to Feed Your Baby's Brain During Pregnancy, the Food and Drug Administration advises all pregnant women to avoid shark, tilefish, king mackerel, and swordfish completely, since they contain the highest levels. Some lower mercury options: salmon, catfish, pollock, whitefish, tilapia, and shrimp. Selecting foods such as these are low in mercury that are a much safer bet. Consuming uncooked meat causes toxoplasmosis, which is a sickness brought upon by a parasite found in raw food. The mother may deal with non-severe symptoms that look kind of like flu symptoms. However, the fetus may suffer from devastating consequences, such as loss of vision and auditory ability and mental deficiency. In order to avoid this horrendous outcome, women should know every ingredient in their food before consuming it. Weight gain is a normal part of pregnancy. However, the idea of mothers eating for 2 is a pastime theory. Based on the articles Nutritional Needs During Pregnancy and Feed Your Baby's Brain During Pregnancy state, if you're currently a normal weight, gain 25 to 35 pounds. If you're currently overweight, gain 15 to 25 pounds. If you're currently underweight, gain 28 to 40 pounds. Eating in excess or gaining too much weight during pregnancy can cause the child to be born prematurely. Premature births can lead to children having low intelligence quotients. This is due to the infant not getting the extra nutrients offered from the placenta. Limiting food in effort to not gain weight can be dangerous for the mother and growing child. The most common exercises for pregnant women to do are swimming and walking. Other exercises can be done in low impact and in small amounts. High intensity and contact sports should be avoided, as it may cause harm to the unborn baby. Some women should avoid exercise altogether. It is best for women to talk to their doctors before performing any activity. Kegel exercises are excellent for strengthening the pelvic muscles in preparation for labor and repairing the muscles post-labor. In conclusion, having a balanced diet and moderate exercise can help in making the weight gain of pregnancy less stressful. Giving in to occasional pregnancy cravings in moderation brought on by hormones is acceptable. However, the hint there is occasional and in moderation. The most important part of these nutrients is getting the proper amount to help the fetus fully develop. While eating, mothers' plates should be vibrant and colorful, covering the bases of each food group. This is advised to help make sure that they are consuming a nutrient-dense diet. It is the mother's responsibility to sustain and support the life inside of her. To expecting mothers, consider what goes into your body and know it goes into your baby's as well. The health of your baby is in your hands.